Well, hello again. So now we're going to discuss the importance of serotonin excess and also the complications or the conditions that can happen when there is an excess serotonin and what that means. This is a slide that I showed you earlier. So as we know, neuroendocrine tumors can be anywhere in the body. And depending on where they are, they can also secrete a series of peptides or hormones, and based on that, they can have very different clinical manifestations. And we're going to focus mainly on what it is the small bowel, which is the one that is known, the most common, that produces excess of serotonin, causing carcinoid syndromes, and that's what we're going to talk mainly on this session. Now, in terms of the GI neuroendocrine tumors, more than 90% of patients with carcinoid syndrome, earlier we discussed about what carcinoid syndrome was, what the symptoms associated with carcinoid syndrome, and what it say here is that more than 90% of patients with carcinoid syndrome involve the liver, with primary tumors either in the distal small intestine or proximal colon. So now let's discuss a little bit in detail about how the serotonin pathway is produced, because I'm sure you have heard a lot about 5-HIAA and how do we measure 5-HIAA and what is serotonin and what is the relationship between that and neuroendocrine tumors. And this is just a little bit of kind of like a figure to understand that part. So we have here a neuroendocrine tumor. So we look very detailed, or a part of the intestine. If you look very detailed here, and there is kind of like you go into the microscope and you're very detailed into the cellular level, this is how it looks. So there is this is the intestinal crypt. So there is an intestinal crypts, and around these crypts there is different type of cells that have different functions. One of them is the enterochromaffin cells, and this is one of the ones, and this is more in detail what they do. So this is enterochromaffin cells, and these cells are responsible to produce peptides that are responsible as well for intestinal motility. So in these situations, and for that, it needs tryptophan. So what is tryptophan? Tryptophan is an amino acid. Usually it's an essential amino acid, and that's most of the time is acquired from diet. But when that is acquired, so then it's converted into serotonin by this enzyme tryptophan hydroxylase, and we're going to discuss about that. And that's responsible for the production of serotonin, and then it goes into the circulation, and then we measure in the urine via 5-HIAA. So that's the pathway of how serotonin and 5-HIAA is produced. Now, what is the effects of serotonin? So the effects of serotonin, as we discussed, can cause carcinoid syndrome, but at the same time is known to also cause tumor growth. And we're going to talk in more detail about that. Now, again, this is another schema about serotonin and neuroendocrine tumors again. So you have a neuroendocrine tumor that is in the small intestine, and then, and we discussed earlier, these enterochromaffin cells are responsible to metabolize tryptophan to serotonin, and that's what we have here. And then it goes into the liver, and when it's in the liver, that's when it's metabolized, and so it's active peptide. And then again is measured via 5-HIAA in the urine. But what this excess of serotonin do is that it can cause a series of complications, not only the symptoms related to carcinoid syndromes, as we know, like flushing, diarrhea, wheezing, agitation, and so forth. But one other complications that can happen with this excess of serotonin is that is associated with carcinoid heart disease, mesenteric fibrosis, and we're going to discuss a little bit more about that, pellagra as well, and neuropsychological disorders and so forth, and we're going to discuss a little bit more about that. We discussed about carcinoid syndrome. So in terms of the different complications that can happen due to serotonin excess, we discussed earlier about carcinoid syndromes and what are the symptoms related to carcinoid syndrome. We have that the most common that patients report is diarrhea, shortness of breath, flushing. It can also cause heart abnormalities and fibrosis of the heart valve, and we're going to discuss as well how that happened and how we can prevent it as well. And something about, I'm sure you have heard about the 5 E's. And those are what we know may exacerbate these symptoms related to carcinoid syndrome. One of them is epinephrine. Those are kind of like the type of anesthesia that is given by your dentist. The other ones is eating. So there's certain food that may be associated, may worsen the flushing of the symptoms related to carcinoid syndrome. And here is a list of the food that has been associated or have the most content of the tryptophan that can cause or exacerbate those symptoms related to carcinoid syndrome. As I discussed earlier today, so we're looking with food that has high level of tryptophan. Why? Because the tryptophan is the one that is converted to serotonin that goes into the urine, and that's what we see the elevation of 5-HIAA. There are other conditions such as emotions as well, and exercise, and alcohol, wine, beer, and all that. That said, I'm not saying that I want you to stop eating or drinking or doing all of this. I think it's important to experience how you feel with this food. You will know what foods you're more sensitive to in order to, notice that if the symptoms worsen. I have a patient, for example, that she likes to drink a glass of wine with dinner, and sometimes she just give an extra shot, so that way she doesn't have the uncomfortable flushing for that. So there are things that you can do, so that way you can still enjoy the things that you want to do, but at the same time, always talk with your doctor about these and the symptoms and how we can ameliorate a lot of these symptoms as well. We discussed about earlier about the different symptoms related to carcinoid syndrome, and these are some of these symptoms may be also recognized as well. So I you have heard earlier, and one of the issues about neuroendocrine tumors is that sometimes when they're diagnosed in the advanced stages. And sometimes the symptoms, even the diarrhea, abdominal pain, and so forth, they're sometimes confused with irritable bowel syndrome, and sometimes patients are undiagnosed for years. And that's something like Marianne was saying earlier, we need to do further work in order to diagnose this earlier, sort of educate our physicians to recognize that neuroendocrine tumors all of the symptoms can be also related to neuroendocrine tumors, so that way they can be detected earlier in their diagnosis as well. So diarrhea is often consistent with, it's bothersome. Of course, we discussed earlier, diarrhea and flushing can be some of the symptoms that can be bothersome to the everyday activities, interfere with the quality of life, and I think that's something that we need to always improve as well in the management with neuroendocrine tumors too. We discussed about the different discomforts as because of the symptoms related to neuroendocrine tumors, as well as I cannot see. But we discussed about the elevated production of serotonin is the one responsible and the driver for all of these symptoms. We also discussed as well that diarrhea is the one, flushing and diarrhea are the ones that has been the most common symptoms associated with carcinoid syndrome. Now, carcinoid syndrome diarrhea occurs in approximately 80% of patients, and is often the most debilitating component of the syndrome. Stools may vary from a few a day to 30 a day, and they're typical watery. There's usually no blood present. It can also be explosive type of diarrhea. It can also have symptoms of abdominal pain. The abdominal cramps may be a consequence of mesenteric fibrosis. Dr. Kanji explained earlier about what mesenteric fibrosis is and what the symptoms may be, and abdominal pain is one of that. That can also cause to obstruction, so it's important to recognize those symptoms. Sometimes when the diarrhea happens, it may not be related to flushing either. Sometimes the flushing happens in different times. It's not related. That may happen at the same time. Flushing can be at other times of the day, like I said earlier, maybe associated with maybe alcohol or other things that have elevation of higher content of tryptophan, and may be associated with a worsening of these symptoms. How do we treat these symptoms of carcinoid syndrome? And I discussed earlier that there are the somatostatin agonists such as lanreotide or octreotide. I mentioned earlier that the function of these medications is to control the symptoms related to hormone excess and also to control the tumor growth. I also mentioned earlier that patients that have been on this type of injections and then on the next set of scans, we see certain growth related to the neuroendocrine tumor. In a functional tumor, we keep those injections. We don't remove those injections because that can still continue helping related with the symptoms related to the hormone excess. It may not necessarily help with to decrease the growth of tumor like it was initially given, but it will still help to control the symptoms related to hormone excess. There is also a medication called telotrestat, and I'm just going to talk a little bit more about that. So we discussed earlier about tryptophan, and again, tryptophan is an essential amino acid that then is converted into serotonin. So in order to be converted to serotonin, there is enzyme. It's called tryptophan hydroxylase. So this is the enzyme that helps the conversion of tryptophan to serotonin. And as I say earlier, this serotonin, it then goes into circulation, then it goes into the liver to be active into more bioactive peptide, and then it goes again to circulation, and then it's excreted to the liver, and that's how we measure the 5-HIAA. Now, the medication telotrestat blocks this enzyme, the enzyme that converts tryptophan to serotonin. So you may understand if by blocking this should be less. And we have, and that's the reason why the FDA approved the telotrestat, because not only was proven with this medication that lower the amount of HIA, but it also decreased, by doing that, also decreased as well the number of bowel movements. So the telotrestat is a medication that is approved for carcinoid syndrome diarrhea. There is another medication Dr. Chauhan also discussed earlier, is paltusotine. This is another type of somatostatin agonist, an oral type of medication. Paltusotine also is the indication when the study was presented was for carcinoid syndrome and also with carcinoid syndrome diarrhea. Currently, the study is closed for accrual. They're analyzing the data, but the idea is that this could then move to the next phase and make it available to patients. I think we're very encouraged about the results of the study, something that definitely can help patients in terms of controlling the symptoms related to the carcinoid syndrome. As we know, sometimes the injections may not be enough to control the symptoms, but by doing this or doing this instead, there's certainly a possibility, an option to control the symptoms related to carcinoid syndrome. Another condition associated with the excess serotonin is a condition called pellagra. Now, here in the States, it's not very common, and one of the reasons is because there are medications like the sandostatin or lanreotide that minimize this. But in other countries, like in South America or any countries that may not have availability of sandostatin or lanreotide, this is more seen in the pellagra. And what is pellagra is deficiency of vitamin B3, and because of that, they have very specific symptoms related to diarrhea. They also have neuropsychological abnormalities. They also have skin manifestations, all because of vitamin B3 deficiency. Another name for vitamin B3 deficiency is called niacin. So I would just go back to, so you may ask, how this happens. So, and I'll tell you how this happens. So let me just go back to one of the slides. So maybe this one will be a little bit better. Sorry. Well, let me just go this one here. So how this happened is that here. How this tryptophan deficiency happened. As we discussed, tryptophan is essential amino acid. Most of the time is acquired from the food that we acquire. But if you have a tumor with carcinoid syndrome, all this tryptophan is utilized to make serotonin. And because it's utilized to make serotonin, then patients can be deficient of tryptophan. So that's the reason why, and it can cause pellagra or this deficiency of vitamin B3. Again, it's not something that we see here in the States very often. It's more often in patients that they don't have these medications to control the symptoms related to carcinoid syndrome. Now, in terms of how do we treat pellagra, the treatment is with basically niacin or nicotinamide. That's one of the medications. And I don't want you also to go to the drugstore and get vitamin B3. I'm not asking you to do that. I'm just asking you that this could be a condition unless there is deficiency of vitamin B3. That may be something to consider. But other than that, I would not recommend getting a vitamin B3 unless there is signs that you have a deficiency of niacin. But that's a condition that has been seen, again, not necessarily here in the States, but more in other countries where somatostatin agonist is not available. Now, other condition associated with the excess of serotonin is carcinoid heart disease. I'm sure you have heard as well about carcinoid heart disease. And 50% of patients with carcinoid syndrome may also develop carcinoid heart disease. It's also associated, the higher the level of HIAA is possible, that can be related to worsening as well carcinoid heart disease. And that's one of the things that we're trying to focus and detect earlier, because now with echocardiogram, more frequent echocardiogram, we can detect this earlier, but we're learning as well how to manage carcinoid heart disease. So this is another picture of how carcinoid heart disease happens. Again, this is the tumor, the neuroendocrine tumor cell that is producing a lot of serotonin, and this excess of hormones then accumulates. So this is your heart. So you have the valve here. This is your right side of the heart. This is a picture, and this is your left side of your heart. So usually the one that's affected is the right side of the heart, just because the relationship as well, the anatomy and relationship with the liver. So usually it's that side that is affected. This excess of serotonin causes scar tissue on the heart valve. Usually when that happens and it's advanced, patients need to go valve replacements in those situations. But how we can prevent that? And that's one of the things that now in terms of the management of neuroendocrine tumors and how we can detected earlier, so always is important to obtain, to measure the 5-HIAA. We still don't know what is the best number that has been associated with the highest risk of carcinoid heart disease, but most of what we know, if you have levels greater than the 300, then it's important to start the process of screening for carcinoid heart disease. And that's where we're obtaining a 24-hour urine. The blood test for 5-HIAA is not widely available. I believe only Mayo Clinic has it. In Europe, they have used this blood 5-HIAA more often, but here in the States, it's only a couple of places that may have that. It's equivalent. It's also the same in terms of how they can measure 5-HIAA, but that's also a way to do it. But it's important to always obtain with your follow-up a 24-hour urine 5-HIAA. It's important to, if the 5-HIAA is elevated, so the indication is to also test for another blood test. And this blood test is called plasma terminal pro-brain natriuretic peptide, or we also call it BMP. And basically what it is that this type of test is related to how the heart is able to pump. So if there is the pump of the heart is not working properly, so this is a blood test that can be elevated in relationship with that. So if we have elevation of the 5-HIAA, then also it's important to measure this blood test, and then also it's indicated to do an electrocardiogram as well. The current European, the ENETS guidelines, Dr. Shahan was mentioned earlier about the ENETS, but the ENETS guidelines recommend not to do an echocardiogram every 6 to 12 months. I know that sometimes insurance may be an issue, but even once a year echocardiogram may be indicated as well. There is a study. I believe that the lottery studies in the States may be only open in MD Anderson, but they also wanted to understand the effect of this medication on carcinoid heart disease. As we discussed earlier, the lottery study inhibit the enzyme that convert tryptophan to serotonin. So we know that it has effect on lowering the level of 5-HIAA as well as lowering the number of bowel movements. But also the studies also wanted to understand what is the effect on carcinoid heart disease. So there is an ongoing study. My understanding is an international study, but also here in the States, MD Anderson, the first one that has this open study. This is for patients that have suspicious for carcinoid heart disease. And the last thing that I'm going to talk about, complications of excess of serotonin, is also mesenteric fibrosis, which is also another clinical manifestation of serotonin production. We discussed earlier, Dr. Ganjin also discussed earlier about some of the symptoms of mesenteric fibrosis. This is usually the worst case scenario of mesenteric fibrosis. This is kind of like where they look at the CT scans. It's also called as a sunburns period, so because you have like these things like look like the sun. and basically because of this, it can be associated with abdominal pain, obstruction. This is one of the more severe cases, but if there is a more mild case, Dr. Ganji was discussing early possibility of surgery when there's a more mild case to prevent further complications later on. And how this happened because also this excess of serotonin around the lymph nodes and the tumor, and it's important to recognize that. And how do we treat that is important as well, to lower the excess of serotonin as well, to prevent these complications later on. And we discussed the different complications related to carcinoid heart disease. We discussed about, the complications related to carcinoid, to serotonin excess. So we discussed about carcinoid heart disease. We discussed about pellagra. We discussed about carcinoid syndrome. We discussed about cognitive impairment, but that's usually related to niacin deficiency related to pellagra. And we also discussed about the different symptoms related to carcinoid syndrome as well. And some of these carcinoid crises are depending on the excess of serotonin too. And how do we manage this? So we discussed about the different complications related to serotonin excess, and then what are the different therapies for that. So we discussed also that it's important to block the production of these hormones. And one of this is, as we discussed with the somatostatin agonist, lanreotide or octreotide is important, but another one that we discussed as well is with the lotristat that inhibit this enzyme that convert serotonin to tryptophan. So there's different ways to kind of like target serotonin in order to lower the levels, but at the same time, as this slide that I showed earlier, there is different therapies as well that by controlling the tumor growth or shrinking the tumors, that can also help as well to control the symptoms related to serotonin excess. And those are like for PRRT with lutetium, that's also known to decrease the levels of serotonin as well. We discussed about the somatostatin agonists. We discussed about the different targeted therapies. As I discussed earlier, the reason why they're called targeted therapies because they target specific protein within the tumor cells. And we have everolimus, and then we have sunitinib. Sunitinib is only approved for pancreas neuroendocrine tumors. We have the chemotherapies, as well as we have different surgeries. And Dr. Ganji, Dr. Malucha discussed also when surgery may be indicated in a patient with neuroendocrine tumors. These are also we discuss about the different target therapies. Important also to understand what could be the possible side effects, and even with these possible side effects, there's always ways that we are able to improve the symptoms related to that, as well improve the quality of life for these patients too. And then this is my last slide, Bob. And then this is the summary. So these are first, the serotonin excess is what is the driver of carcinoid syndrome. And this serotonin excess also plays a role on the complications that we discuss. We discuss about carcinoid heart disease. We discuss about mesenteric fibrosis. The pulmonary artery hypertension is secondary also to the carcinoid heart disease. We discussed pellagra, but like I say, niacin deficiency is not something that we see commonly here. And it's important to control the excess serotonin in order to also improve the quality of life. By doing that, that can also help us, patients, to minimize all these complications that we discuss as well. And by controlling the serotonin also has an effect on the tumor growth too. And with that, these are the net clinical trials at the NIH. I'm happy to answer any questions if you want to learn about the program. And I would like to thank you for your attention. Thank you.